Greetings, families. Welcome back. Thank you so much for clicking on this video. If this is your first time, my name is Mamri, and you are very welcome. My returning families, my VIPs, my kings and queens, thank you so much for your time. I'm so grateful. This is a quick update from Burkina Faso. You remember last year, the medical equipment, the generators, the machines, the laptops, a lot that President Ibrahim Traore has surprised us with. Yes, before the beginning of this year, there was an announcement that they will subsidize a lot of diseases, treatment of diseases, cancer and the rest, and those who have liver problems, they will subsidize, and they don't want only the rich to benefit from this. We know how expensive it is when it comes to the organs of the body. Yes, so he wanted to be affordable and some of them free. They want to give us a summary of what is going on in the medical sector. In short, please watch and listen, and I'll be back. Thank you so much for your time.
Today we take a look at the major actions that marked the year 2024 in the field of health. In fact, the year 2024 saw a number of government actions, notably the subsidization of medical procedures linked to chronic diseases such as renal failure, magnetic resonance imaging examinations, the institution of the Presidential Initiative for Health, the handing over of mobile clinic cases to health facilities, in short. The recently concluded meeting of the executive saw the head of state's vision for public health unfold. Isn't that Ishakana? Like a New Year's gift, 2024 begins with good news for kidney failure patients in Burkina Faso. At its meeting on March 13, 2024, the Council of Ministers decided to subsidize medical procedures for chronic diseases such as kidney failure, magnetic resonance imaging, MRI, and dialysis in Burkina Faso's public hospitals. The vision of Captain Ibrahim Traore ensures healthcare access for all Burkina, regardless of social class. In line with this vision, the transitional government decided to substantially reduce the fees for access to examinations, scanners, MRIs, and dialysis sciences. The lifetime dialysis deposit of 500,000 CFA francs was abolished altogether. The subsidized rates for dialysis, CT scanners, and MRI have been significantly reduced. A new tariff crisis has been in force in Burkina Faso's public hospitals since April 2024. On July 13, 2024, the Council of Ministers also adopted a decree establishing the Presidential Health Initiative, IPS. This initiative aims to modernize healthcare structures and improve the quality of care in Burkina Faso. With an implementation period of 5 years, the IPS is housed within Burkina Faso's National Office for Major Projects and comprises 4 components. Component 1 includes building and furnishing 55 communal medical centers. In particular, it aims to transform 55 social promotion health centers, CSPS, into communal health centers in the country's 13 regions, with general practitioners, laboratory staff, medical imaging specialists and support and maintenance staff to be assigned to these health centers. Component 2, the construction and equipping of 5 anesthesia and intensive care units in hospitals. The aim of this component is to equip university and regional hospitals with anesthesia departments to ensure a degree of autonomy and reduce the need for medical evacuations. Component 3 involves the creation of a heart institute at the Tengango University Hospital. The establishment of the Heart Institute should provide Burkina Faso with a center of excellence in the sub-region in cardiology, covering surgery for children and adults, bypass surgery, heart transplants, heart assistance mechanisms, treatment of congenital and acquired diseases, and research into the development of artificial hearts. Fourth component, molecular diagnosis of breast cancer. The aim is to provide healthcare facilities. Innovative products not available in Africa. This will enable Burkina Faso to take a major step forward in improving care for breast cancer patients. The improvement and provision of quality health care for people throughout Burkina Faso. The year 2024 would also have been one of challenges for the Burkina Faso government. The government's determination and vision are reflected in the acquisition and handover of 15 mobile clinics to health facilities in the country's 13 regions. July 25, 2024. 15 mobile units equipped for specialized care such as mammography and ultrasound. These mobile colonoscopy and thermocoagulation clinics, the first major experiment by the Burkina Faso government, have been deployed to villages, the countryside and certain outlying areas of towns to provide ultrasound scans, cervical and breast cancer screening and breast care for children. The aim is to bring healthcare closer to the most vulnerable populations in all regions of Burkina Faso, in order to offer quality care. Says Captain Ibrahim Traore, who himself hands over the keys to these mobile clinics to the Minister of Health. Mobile clinics with cold chain and tablet equipment to guarantee vaccine quality at all levels of the healthcare system. 12 station wagon vehicles, 11 pickup vehicles, 13 refrigerated pickup vehicles, 1,900 refrigerators with solar kits, 110 electric freezers and 14 generators. A cold room and 835 tablets were handed over to the Minister of Health by the President of DI Faso, Captain Ibrahim Traore.
Thank you, families, for listening. Wow. I remember when I shared a bit of this video, somebody says, I'm moving to Burkina Faso. Yes, they are doing everything they can, and they should. They should, because the natural resources in the land need to benefit the people. I came across a video that shows how these natural resources, if they are not used well, which before they were doing that in Niger, how it's affecting the population, some of the populations, citizens that are close to this site. I know about Congo, but I didn't have an idea that is destroying a lot of people in Niger as well. So it is good. It is good that they are using the money to look after the people. At the end of the day, it is their money anyway. Great news. I want to share it with you how they are doing it. And it's not just by saying it. I always say that here because what I've seen is what I share, and I always try to bring receipt. They didn't import all those machines and lorries to come to the country and then it vanish like some other countries do. They are going to the villages and they are working. And if you doubt it, okay, some of the videos are on this channel. Let me know. I will link it for you to watch it. See is believing. Thank you very much. We congratulate them. We pray for long life for them to continue to do what they are doing. Yes, this is how it's supposed to be. You don't have to travel abroad for treatment. You can be in your country, your village, and the treatment will come to you, or you travel a short distance and you get your treatment. This is how it's supposed to be. I said that twice. I will leave you here, families. Thank you so much for your time. Credit to our TB News for sharing this with us. Families, I'll be back with another news. So I will see you soon. Like the video, share it if possible. And if you are new here, please subscribe to join this family. We have an amazing family here. If you don't believe me, go to the comment section and you will know what I mean. I will see you soon. Bye bye.